Billing for substance use disorder has always been complex, but 2026 has introduced a new layer of scrutiny. Are you confident your documentation creates a bulletproof narrative for medical necessity? This year, we are seeing a shift toward bundled payment models and stricter requirements for level of care justifications. Payers are no longer just checking codes, they are auditing the timeline of treatment. The biggest risk in 2026? Recoupments. If your intake assessments don't perfectly align with the new 2026 criteria for residential versus outpatient treatment, you risk clawbacks months down the line. Your counselors are there to help patients recover, not to memorize insurance manuals. Burdening them with these new billing intricacies takes time away from patient care. That's where 24/7 medical billing services comes in. We specialize in behavioral health. We understand the specific nuances of SUD billing, from V codes to specific bundled rate negotiations. We ensure your claims meet the strictest 2026 compliance standards, protecting your facility from audits while maximizing your reimbursement per episode of care. Keep your doors open and your focus on recovery. We'll handle the revenue cycle. Unexpected audits? Let's review your compliance today. Contact us today.